So in our next segment, we're going to talk about stopping the bleed. Now, in an active shooter situation, you're going to see a variety of different wounds. It's important to remember that you have major arteries running throughout your body. And when these arteries get struck, it'll lead to a massive hemorrhage that can lead to loss of consciousness and even death within a matter of minutes. So it's important to treat those wounds quickly. On your body, okay, just going over it, is you have your brachial artery running just on the inside of your bicep here, your radial artery, which is what you can feel when you take your pulse there. You also have your femoral on the inside of your leg and your tibial running down your shin, essentially, okay? And to treat those wounds, the quickest, fastest, easiest way to do it is going to be through the application of a tourniquet. Now, when it comes to tourniquets, you have two different options. You have either a manufactured tourniquet or an improvised tourniquet. So when it comes to a manufactured tourniquet, it looks just like this. There's a couple different brands out there. Some of them look different, but the concept's generally the same. You have a loop, a strap, generally some Velcro, and a windlass right here. This little toggle made out of either, this one's plastic, made out of a hard plastic. Sometimes they're made out of metal as well. We recommend, if you can find it, it's called a soft T tourniquet. You have a metal windlass. You're gonna have to put quite a bit of torque on this, and sometimes they can snap. So if you can get one with a metal handle on them, they're only about 25 bucks. Now, when you pull your tourniquet out of the packaging, it'll come packaged something like that. Generally, this little tab right here will be facing the outside. You pull it out of the plastic. It's important, if you have them, prep them beforehand. Maybe stick a rubber band on it so you don't have to waste time taking it out of packaging. When you grab it, you keep that tab to the ground, and this is on either self-application or buddy application, whether you're putting it on yourself or a partner. You're gonna grab it, that tab facing towards the ground, just like that. Why that's important is when you put this tourniquet on, if you're putting it on yourself here, is all your leverage, okay? You slide it over the extremity, and all your leverage is gonna come from pulling in. If I was to turn this around, you can see that when I pull down, it tightens. And you wanna get as much tension out of that as possible right off the get-go, okay? If I was to turn it around and try and do it from the other side, you can see it just kind of pulls over. I have to pull it back and kind of ratchet it. And then it's harder to get to my windlass on the other side. So always keep that tab down, pull that tab towards your heart, whether you're putting it on yourself or another person. Once you get it on there and tension down, take as much tension out of that as possible, putting it on, then you take your windlass and you're just gonna simply turn. You're gonna turn all the way until the bleeding stops, and you will see it stop. Once the bleeding stops, you just take that windlass, stick it in those little tabs that'll be on the manufactured tourniquet. And that's a manufactured tourniquet. You can get a volunteer here. So same thing when you're putting a tourniquet on somebody else, okay, is they might not be able to lift their leg, so you might have to take the tourniquet completely apart. Take it apart, feed it underneath, back through the little loop here, just one time is all it has to go. And then once again, you're pulling this tab towards yourself to take all of the tension out of there as possible. Now, there's a couple different theories of thought on this. Is you may hear some people tell you to apply the tourniquet 2 to 4 inches above the wound itself, depending on if it's on the lower part of the extremity or upper part of the extremity. You never apply a tourniquet over a joint, no matter what you're doing. But to take some of the guesswork out of it, we're gonna tell you, put the tourniquet high and tight on the limb. Whether it's your arm or your leg, get it as much up into the joint while keeping that tourniquet perpendicular to the extremity itself. Keep it straight. You don't want it at an angle. Again, take the tension out of it as much as you can. fasten it down, and then turn your windlass until the bleeding stops. Now it's important to remember that this is not going to feel very good for your patient. If they haven't passed out already, they might do so. They might scream, they might flail, they may tell you to stop, but it's important to keep this windlass turning until you see the bleeding itself stop. The next option, if you don't have a manufactured tourniquet, is an improvised tourniquet. Sometimes in TVs and movies, you might see people use something like a belt. Now, the problem with a belt, well, it may look cool on TV, is there's very little way to secure it. There's very little way to get a knot in it. And there's not a lot of good ways to apply tension. It's just gonna turn, it's gonna pinch, and it's not gonna apply the pressure you need. So you wanna use something like a nice thick fabric. Denim generally will work. Something like these khaki pants here. Maybe a solid necktie. You want something that's gonna hold up under the tension you provide. You want it to be anywhere from 2 to 4 inches across and long enough that you can tie it and secure it. I'll get my volunteer up here just to show you. So what you can do is, one, you're gonna wanna remove the patient's clothing anyways to expose the wound wherever it is on the extremity. For this purpose, we'll say it's on his calf. So we're gonna wanna cut his pants off anyways. So if we have a pair of scissors, we cut up, right? And to keep some tension on them, you cut up the seam, stop, then grab it, go down about 2 inches, cut up, and then cut it off at the top, remove that, and you'll have a strip that looks something just like this. This is a pair of pants right here. Okay, you take that, again, we're gonna go high and tight on the extremity, tie it down. Where you tie it, you want to tie it where your windlass would be, right? Just on a manufactured tourniquet. Keep it to the outside because this major artery is on the inside of the leg. So you want all your pressure pulling that artery against the bone. Is where we're trying to apply pressure to the bone here in this case. So you tighten it down, get it as tight as you can. And then I'm just gonna use a little wooden dowel, but you can use something like a ruler, a marker, a spoon, whatever's strong enough to hold up to the torque of tightening this thing down. So you tie it once and then complete your knot with the windlass in the middle. And then from there, just like the manufactured tourniquet, you're just gonna twist this thing and twist it until all of the bleeding stops, okay? And then once we get to this point, is if you don't have anything else to secure it with, you're gonna have to hold it until outside help arrives. But we recommend, since you may have to move the patient, is getting something else, another piece of fabric, maybe the other side of the pants, cutting it off, using something like a necktie. You can also use a necktie as the initial tourniquet application. But you're gonna do essentially the same thing as you did. Keep that windlass in place. If you have to move it a little bit to get this knot on here, go tighter, not looser. Okay, put a little bit more torque into it, not less. Get your first knot right under there, and then your second one right over top, and that will hold that windlass in place. Because once we tighten a tourniquet, we never ever want to take them off. If the bleeding doesn't stop, you can apply a second tourniquet, but just never ever take them off. Okay, so the next thing we're going to discuss is packing a wound. Now, some people, you may hear you need to pack a wound first before applying the tourniquet. We recommend applying a tourniquet before packing a wound. If you don't have that bright red spurting arterial bleed, you can go to packing a wound first. But if that presents, if you get that arterial bleed, stick a tourniquet on and then worry about dressing the wound second. So in order to pack a wound, whether arterial or not, a couple things to remember is you can only pack a wound if it's on an extremity, okay? On an extremity or an junction, like your shoulder or your hips. It's very hard to pack a wound in the hips, but you can try. There's a lot of veins down there, and most of the time it's not very successful. But you want to pack, the purpose of packing a wound is to apply pressure directly inside the wound cavity. You're going to use your gauze just like this. If you have gloves, take your gloves, put them on, because we're going to get a little bit messy with this one. Take your gloves, put them on, get your gauze out of the packaging. Now you have a couple different types of gauze. You have just regular gauze, which is what I'm using here, or you have hemostatic gauze, which is made by companies like QuikClot, which you may have seen. We recommend using hemostatic gauze if you have it. If not, regular gauze will work just fine. And take it, put a little knot in the end of your gauze, and then with that knot, what you're gonna do is you can first take your finger, stick it inside the wound cavity to kind of find the end of it. And if you have an arterial bleed, you'll be able to feel the pulse inside that wound cavity. Is find the end of it, find where the bone is, and then what we're gonna do is take this little knot here, stick it down inside the wound at the very end of the wound cavity. And what we're doing is applying pressure against bone. And then from there, once you stick it in there, you want to keep pressure on it, and you're just going to alternate fingers. Is get your gauze back and forth, keeping pressure as you stuff that wound. Now, once again, as you do this, it's not going to be very comfortable for your patient. They're probably going to scream, maybe flail, more than likely probably pass out. But you keep going until that wound is fully packed and that bleeding subsides. Okay, keeping pressure on it the entire time. Now, it might not just take one roll of gauze, you might use multiple. But once you get to the end and that wound is fully packed and that bleeding subsided, okay, you take your gauze, you can keep it nice and rolled up just on top, and then you're going to apply pressure, just like you're giving CPR. Walk your arms out, and if you're not using hemostatic gauze, apply pressure for 10 minutes before you apply a pressure dressing to the wound. If you are using hemostatic gauze, then you only need to apply pressure for 2 to 4 minutes. So once you've packed the wound, you're going to want to apply a pressure dressing. Okay, it'll come prepackaged, looking something like this here. You take it out, it'll look like this with a little white spot on it. That white spot is just a little bit more absorbent, and that's what you want to stick over top of the wound itself. You take that, stick it over the wound, right? And we're gonna say this is a patient's leg right here, okay? I'm gonna have to move it a little bit more than I would normally if I was applying it on an actual patient. Well, you'll take it, wrap it once, get it nice and tight, okay? As tight as you can. And then this little plastic piece on top here, you just run it through that plastic piece, okay? Get some tension on it, and then back towards itself, and you're just gonna wrap in the other direction, tightening as you go. And that little plastic piece is just gonna give you a little bit more torque on there to apply pressure directly on top of that wound. So you wrap it, tightening as you go. Pull it tight after each wrap. And then as you get to the end, you'll see another little plastic piece here. And all this does is secure the dressing to itself. So you pull that tight, find some dressing in there, stick it in, get as much as you can in there. And now your wound's dressed. So the next thing we're going to talk about is a wound in the chest cavity, okay? Also called a sucking chest wound. And this happens when the lung is pierced front to back. You have an entry wound, and more than likely If you have a wound on the front, you're gonna have an exit wound on the back. So you need to treat both. The first thing you're gonna wanna do, obviously, is remove the patient's clothing. Once you find the wound, right, you can treat this one or two ways. Either with what I have here, these are manufactured occlusive dressings or chest seals, okay? They generally come in packages of 2, just like this. Once you open them, it'll look just like this, okay? You have this little occlusive dressing, and as you can see, it's pretty sticky on here. So you can pull it off, sticky side to the patient, find the entry wound. They come with a little bit of gauze in there. The gauze isn't to stick inside the wound. Again, we can't pack anything into a chest cavity. There's nothing to pack it against. So you're just gonna wanna wipe away the blood from the outside of the wound, kind of clean the area so that you get a good seal with your chest dressing. When you get a wound in the chest, the blood's gonna look pink and frothy, and that's not how you know it's pierced, so long as the air escaping is gonna cause it to bubble and give it a pink appearance. You find that wound, you find the center of your dressing, the big area in the middle, peel it off, okay, which I'm not gonna do here. You peel it off and then stick it with the center of the wound directly center of that dressing, okay? And what this is gonna do is it's gonna allow air to escape the lung cavity without sucking more air in as the patient attempts to breathe, okay? And if you stick one on the front, if you have an exit wound on the back, you also need to stick one on the back, okay? And then once you do that, you just monitor the patient and transport as quick as possible. If you don't have a manufactured occlusive dressing or chest seal, what you're gonna wanna do is use an improvised, all right? And the simplest way to do that is just with a piece of plastic and some tape, or 2 pieces of plastic. You can take a Ziploc bag, which most people have in their lunch kit, tear it into 2 pieces, use each side for the front and the back of the patient. And all you're gonna do is place that chest dressing, place that little piece of plastic directly over the center of that wound, and then you're gonna tape it on 3 sides. Okay, I'll show you how to tape it here just on the table. We'll call the center of this dressing our wound, okay? And then just with your tape it down on 3 sides. The reason we tape it on 3 sides is to, again, allow the air to escape without it getting sucked back into that chest cavity. Now, when air gets sucked into the chest cavity, what it can do is apply pressure on the other lung and your heart, collapsing it. So we want to prevent that air from going inside the chest, allowing it to move out without it coming back in. To finish up, we want you to understand that however informative this might have been, is it's important to seek outside training. Get hands-on actual training from a tactical medicine class. They're easy to find online. Look them up, they're all over the place. Get your hands on. The best training is gonna be doing it yourself, not just watching a video. Thank you.